It's Friday on Risk and Reward. That means elevator pitch day. One entrepreneur, one elevator, 30 seconds. It starts now. I am here with Karim Farag. He is the co-founder and CEO of uGo Health. Karim, what's your idea?
uGo Health is a personal health assistant. Our mobile product reduces avoidable ER visits by helping users understand when and where to access medical care based on their symptoms or condition. 50% of all ER visits are completely avoidable. They could have been treated anywhere else. By helping users get to the right care at the right time, uGo Health is reducing the $38 billion of waste in the ER.
Saving time and money is a good idea.
That's right.
We'll see what the judges tell you. So that is the pitch. Speaking of the judges, here they are. Matt Witheiler from Flybridge Capital Partners, Vince Ponzo from Columbia Business School Center for Entrepreneurship, and Ryan Armbrust from FF Venture Capital. Matt, what did you make of the pitch?
Yeah, I thought you did a great job on the pitch, and the waste that you're eliminating makes a lot of sense. I think the biggest question for me as an institutional investor is how you think about scaling the business. In particular, think about customer acquisition. The health space and online health space that you're targeting for consumer information is quite crowded. How do you think about attacking the customer acquisition side of this business?
Sure. So we're a business-to-business to consumer product. So our customers are actually the risk-bearing organizations, health insurance companies, self-insured corporations. That's who we're selling to. So scaling the business will be going to those organizations, licensing them our product, customizing it for their member populations, and basically charging them a per member per month fee.
Great, thanks.
Vince.
Yeah, interesting. So you just said you're B2B, but my question would be, how do you plan on the end user side to stand out in this crowded field of symptom checkers?
Sure. So on the consumer side, there's really a lot of white space for what we're doing exactly. We're trying to get people to the right care at the right time based on their symptoms. There's lots of health sites and portals that have content and symptom checking technology. They're really media businesses selling advertising, so they spin people off into content and have them generate page views to sell advertising. On the other side, there's directory sites like HealthGrades that just have you look for a doctor, you understand you need a cardiologist, a zip code, insurance, and then they find you that type of provider for you that takes your insurance. There's nothing in the middle that bridges the gap between symptoms and condition content to the type of provider that you need to evaluate and treat you. So that's the white space we're occupying, and we're bridging that gap with something called our care recommendation engine.
So Ryan, I'm jumping the queue. I want to know who saves the most money and how much.
So both parties, the consumers are saving time and money because they're now on the hook financially more than ever before with high deductible plans. So the first $1,000 to $3,000 in your plan, the consumer is responsible for paying. On the health insurance side or the self-insured corporations, they're also saving money because we're lowering costs by making sure people are redirected out of the ER when they don't need to be there to lower cost settings like retail clinics and pharmacies and urgent care centers.
Ryan, what do you think?
So my big concern and question is kind of around privacy. Obviously a big hot button issue right now. If you're working with my insurance carrier and you're getting basically an ongoing list of what symptoms I may have, what kind of concerns should your users be aware of or be,
Sure. So we're HIPAA compliant, right? So in health, we need to secure the information, especially medical information. So we will have that secured through HIPAA compliance standards. We're also not going to be sharing information unless the user basically tells us that we're allowed to share them with medical providers downstream. So there's standards for HIPAA compliance and security, and we will do that.
Matt, based on what you have heard, would you introduce Karim to your investing partners or not?
Yeah, I think I would, and I'm not going to say it's an easy one for us. And the reason I say that is because we would put a lot of pressure on how you actually sell into the businesses, into the providers you sell into, and how long those sales cycles can be and how hard it can be to take dollars from them. So that would be the focus of my investigation.
So Vince, biggest takeaway, plus biggest takeaway, minus, and then your final vote, does he get an intro or not?
I like how you describe the space that you're filling. I do think that it is a crowded space on the consumer side, but to carve out the space and describe it the way you did, I think makes it more interesting. Biggest negative, I would say, from my standpoint is you really still have three key constituencies here. You have end users, you have hospitals and providers, and you have payers, which means that you're actually going to be going after, to some extent, simultaneously each of those categories, which I think is going to be a little tricky. But at the end of the day, based on your pitch and based on what I know of your background, I would introduce you as well.
Ryan, yay or nay for intros?
You know, I think we would. I think I'd take an intro. You know, I did a little diligence on your background and really saw your founders come from a healthcare, digital strategy side. I'd be interested to see how you guys are taking that and approaching this area.
That's 3 yeses, Karim, as far as I'm concerned.
That's
Thank
great.
you very much, Karim Farag, joining us there. He is the co-founder and CEO of uGo Health. Matt Witheiler of Flybridge, Vince Ponzo, Columbia Business School, and Ryan Armbrust, FF Venture Capital are the judges. Thank you all.